Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Oligohydramnios and Potter sequence. Potter sequence is also called Oligohydramnios sequence. First of all, we must know the definition of the Oligohydramnios. What is Oligohydramnios? Oligohydramnios is a condition when there is decreased amount of amniotic fluid less than 400 ml in late pregnancy. What are the causes of oligohydramnios? Oligo means small, hydramnios means that amount of fluid, amniotic fluid is less, so it is oligohydramnios. What are the possible causes of oligohydramnios? Rupture of amniochorionic membrane, bilateral renal agenesis, polycystic kidney disease, type 1, urethral obstruction, or ureteric atresia, placental insufficiency that may be due to maternal hypertension like that of preeclamptic toxemia or eclampsia. So there will be less amount of oligohydramnios. Oligohydramnios is a condition when there is less amount of amniotic fluid. Baby is in the amniotic cavity in the mother's uterus. Amniotic fluid is a cushion, it is a protection, it is for nutrition, it is for the development of the developing fetus. So less amount of amniotic fluid will hamper everything, and the amniotic membrane will compress on the baby. So we'll get the sequences due to that problem. And we know that amniotic circulation, every day by 24-hour, baby swallow around half liter, maybe 400 ml of amniotic fluid, and it passes urine around 400 to half liter in 24 hours. So this is a continuous cycle. It swallow, it passes urine, so there is circulation is maintained, amniotic fluid is maintained due to addition of urine. If there is any bilateral renal agenesis, no urination in the amniotic cavity, no buildup of normal amount of amniotic fluid, so there will be oligohydramnios. So like that, in case of polycystic kidney, so the kidney cannot produce sufficient amount of urine, like urethral obstruction, and also in case of urethral atresia. Placental insufficiency is very important because baby is supported by amniotic fluid actually coming from maternal circulation through the placenta. It is swallowed by the baby, it is aspirated by the baby, and amniotic fluid is very important for the development of the lung because amniotic fluid contains a lot of growth factors and protein like proline, so that will stimulate the growth of the lung and also help in the development of the connective tissue of the lung. So we got that. So what will happen? We'll get in oligohydramnios, our amnion will be nodular in certain places. There will be band formation, amniotic band. There will be bilateral renal agenesis that will lead to oligohydramnios. If there is unilateral renal agenesis, there will be compensatory hypertrophy of the remaining kidney, so there will be no oligohydramnios. Oligohydramnios happen when there is bilateral renal agenesis. Amniotic leak, very common cause of oligohydramnios. At least around 10 to 15% cases due to amniotic leak, there will be loss of amniotic fluid, there will be oligohydramnios. Other causes like we had just discussed, maybe urethral obstruction, maybe fold, especially in the male children, maybe urethral atresia, or maybe placental insufficiency. They all lead to oligohydramnios. So as because the cushion around the fetus is lost, so there will be fetal compression. There will be pulmonary hypoplasia. As I mentioned, the amniotic fluid is very essential for the growth of the lung, because the lung is getting amniotic fluid by the aspiration of the baby, that is growth factor and also connective tissue proline. So without that, there will be pulmonary hypoplasia. Also from outside, there will be compression because the cushion is lost. Altered faces will get the broad nose. We may get epicanthal fold. Hypertelorism, eyeballs are separate out. The distance between two eyeballs is more. And low set ear is low set, we'll get that. And we'll get the changes in the skin, okay, and the hand joints, and also in the lower limb joints. We may get genu varum in the knee joint. We may have club foot, okay, not only in the lower limb, upper limb joint may be deformed, okay. Due to that, there may be hip dislocation. That may be an association of Porter sequence. So Porter sequence happens due to oligohydroamnios. And there will be breech presentation, more possibility, because of lack of fluid. Baby will not get the normal presentation. So there will be more chance to get breech presentation. Buttock will come fast. Usually head should come fast. Okay, so there should be cephalic presentation. Here, more chance to get breech presentation. Okay, so we'll get there. Here, oligohydramnios and Porter sequence. So we are seeing the amniotic membrane making some type of bands. This band may compress the umbilical cord, and that may lead to intrauterine fetal demise. This type of band may also entangle around the limb, and that may lead to limb deformity, even amputation. Okay, that is a possibility. So we can say it is Porter sequence. We may avoid the word Porter syndrome because everything is originating from one problem, oligohydramnios. We got the causes, okay, and oligohydramnios, there will be fetal compression, immobility of the fetus because space is not sufficient. Okay, we'll get club foot, breech presentation, growth deficiency, and pulmonary hypoplasia. So there is chance of intrauterine fetal death. Even the baby is born, baby may not survive in most cases because of pulmonary hypoplasia. Okay, so complete oligohydramnios and Porter sequence, we go there. So what are the complications? Certainly pulmonary hypoplasia, intrauterine growth retardation, even intrauterine death is also possible, strangulation of the umbilical cord, limb defects, and death. Death may be before birth, death may be after birth. Management, bed rest, hydration, amnioinfusion. Certainly consultation with an obstetrician. She will guide or he will guide how to manage a patient of oligohydramnios and Porter sequence. And that's all about the oligohydramnios and Porter sequence. To remember that, we have to say sequence. We may avoid the word syndrome. Sometimes Porter sequence is also called oligohydramnios sequence. Okay, and that's all. And please share the information with your friends. If you have any question, please feel free to ask me. And please support my channel. Please subscribe me. Have a nice day. Bye now.